Now, a doctor could just routinely say to all her patients, eat healthy and exercise 4 to 5 times a week for a month and then come back and we'll see how you're doing. Just do that as a blanket solution to anyone. And that would probably be good advice a vast majority of the time. But if the patient asks them, what should I eat? And how do I get started exercising? The doctor will probably tell them to go see a nutritionist and sign up for a gym membership, because that's not her job. That's true, it isn't. 100 years ago or so, doctors used to manage a person's overall health. Not so these days. These days, medical doctors are now symptom readers and medication prescribers. Do you want the old school kind of doctor? Go see a naturopath or holistic doctor. But be prepared to pay cash, because your insurance is unlikely to cover these voodoo practices that aren't medicine. Translation: making people healthy isn't profitable, so the medical industry isn't interested in it. Don't get me wrong, I honestly feel for the doctors, because they usually only have 15 minutes per patient to actually talk before they have to fill in the paperwork on the computer, and they couldn't possibly have a serious conversation about someone's life and habits in that amount of time. Well, whose fault is that? Who decided that doctors should only have a few minutes with the patient? The medical industry, of course. The whole system is set up that way. You could argue that this system makes things more efficient so a doctor can see more people in a day. Maybe so, and that would work if you're fixing a bone or removing a mole from someone's back, but not when dealing with diagnosing someone's behavior. When modern medicine is moving at lightning speed, but the number of addicted people is skyrocketing, maybe the medical industry doesn't know what they are doing when treating substance abuse. The medical solution is often substituting one drug for another. One just happens to come in a prescription bottle. Okay, so then what about psychiatrists? Aren't they supposed to deal with mental health issues? Sure, but let's be honest, they were the original drug dealers. They were giving out meds like candy before doctors effectively became drug dealers too, so they aren't any different. In fact, they don't even pretend they aren't. Don't get me wrong, I'm not opposed to legitimate professional therapy. We deliver therapy every day by some excellent staff at my facilities, but psychiatrists don't typically do that. That's not their job to talk to people for an hour. They do that one time in order to diagnose and then prescribe meds. That's fine if you have a crazy guy in jail who thinks he's King Kong and needs to be sedated so he doesn't hurt himself or anyone else. It's not okay if it's a typical 12-year-old in school who is struggling and your first thought is to give them powerful drugs as the first solution.